Good morning and welcome. Can you all hear me okay?
Yeah.
Yes, Claire's giving me a thumbs up. Thank you, Claire. So good morning, everyone, and welcome to the Stanford Health Care Nurse Residency Program Application Preparation webinar. My name is Kerry Zoss, and I am one of the Nurse Residency Program Coordinators, and I'm excited to have you all joining us this morning and participate in our webinar. Just a couple of housekeeping items. We are recording this webinar. We will have it available likely within 24 hours on both our careers website and on our Stanford Health Care Nurse Residency Program homepage. So you can look for the recording. It will take you to the YouTube site if you need to check on any of the information that we have provided today. I'm going to ask that if you have HR related questions, please feel free to put those in the chat. Carly Dye from Human Resources is joining us today, and she will be managing the chat. And then if you have specific questions for the Nurse Residency Program coordinators or for the new grads who are joining us today, the Stanford new grads who are joining us today, to save those questions, and we will have a live Q&A session towards the end. So it is with great excitement that I introduce your facilitator for today. I'm extremely pleased and excited that I get to share the role of a nurse coordinator with 3 new individuals for this program. Kristi Norris is one of our nurse residency program coordinators who has joined our team. Kathleen Juco-Purdy is another nurse residency program coordinator who has joined our team. And then your facilitator for today is Leticia Cortez. So she will be facilitating this webinar. So Letty, I turn it over to you.
Thank you, Kerry. Can you hear me? Can you see me? No?
Yes.
You can hear me? You can see me?
Yes.
Okay, perfect. All right. Thank you, everybody. Thanks for attending. Let's see here. Okay, so we're going to start this application webinar. We have some objectives for you, the participant today. At the end of this webinar, you, the participant, will be able to understand the Stanford Health Care Nurse Residency Program as it relates to cohort timeline, clinical placement and department hiring, nurse residency program participation and retention rates, nurse residency program curriculum. You will also be able to understand the Stanford Healthcare process of applications and expectations for prospective applicants. You, the participant, will also be able to describe the application requirements with heightened understanding on cover letter and resume writing. Okay, so like we discussed here, we have our nurse residency program team of Kerry, myself, Kristi, and Kathleen. We also have members of the HR team here and some nurse residents who will be sharing with you in the Q&A session of this webinar. So moving on, nurse residency program here at Stanford, who are we? So we're in a nationally accredited transition to practice program, which means we take newly graduated nurses or nurses with minimal experience, and we provide them a program that is designed for highly motivated, determined, compassionate new graduate nurses over a 1-year time. It includes over 300 hours of clinical orientation with a dedicated preceptor, supplemental education and training seminars, and immersive simulation to support the successful development of newly graduated nurses in the clinical setting. Our curriculum integrates Vizient's 3 principles of domains of leadership, professional role development, and quality outcomes. And it's also, the whole program is guided by Watson Caring Science. The overarching goal of this program is to develop competent, compassionate, and committed clinical nurses who make a positive impact in the lives of our patients. So when we mention Vizient, our program follows the domains of Vizient's program. And first off, it's important to discuss what is Vizient. So some time ago, the academic medical centers realized that a lot of nurses who were new to the career or new to the field were leaving all before their first year of completion of their nursing roles. So they reached out to nursing schools and partnered and tried to figure out why. And in the discussions of that, they developed a nurse residency program. And the Vizient nurse residency programs support new nurses as they graduate and transition into their first year roles but it's built on evidence-based curriculum developed by experts in academic medical centers and nursing schools across the country. And the program focuses on 3 critical domains of leadership, patient outcomes, and professional role. So the goal of our program is not to reteach you anything that you learned in nursing school. The goal is to take from the skills and the knowledge that you gained in your educational preparation, and also just any skills that you developed from your work experience, and to use those and build upon them to get you to apply that to the point of practice. So when we look at the leadership domain, we look at that and we learn how to discuss conflict resolution, patient care coordination, professional communication, how do you escalate, resource management, how do you find the resources when you're not 100% sure of what's going on in the clinical setting, and how to delegate. When we look at patient outcomes, we work on what do you do if you're working with a patient and they're deteriorating, the clinical picture of the patient is changing. How do you teach patient and family? So how do you focus on not only doing patient teaching, how do you integrate the family members? Who are the key players in having a successful discharge or continuing of care of the patient? How do you address pain management? What are the strategies that we can tap into and use? Infection prevention, and also, managing wounds and skin integrity. When we look at professional role, we want to see how we can prepare you to manage stress and incorporate self-care. How do you deal with the presentation of ethical decision-making, implicit bias? How do you deal with social determinants of healthcare and of life care situations? If you've never been in that situation before, we try to prepare you with those tools to navigate that. We always include evidence-based practice in all of our teachings. And how do we develop you to grow and develop in the professional environment of healthcare? So when you look over to the side of this slide, we have 4 buckets that we use in the program, and they're clinical orientation. So one part of our program is the dedicated preceptor during your orientation time. And like we mentioned before, you have over 300 hours of that. Seminars and simulation. So that's hosted by us, the NRP team, and we bring you in and we work with you in seminar and simulation case studies. And we also immerse our nurse residents in an evidence-based project that will be headed by a clinical nurse specialist in your service line. So you work with the CNS and people within your units to work on a project of evidence-based care. And we make sure that throughout the first year of your program and of your career, we provide you a supportive and collaborative environment. So we have check-ins with your leadership team, your education team, including someone from the NRP program, your clinical nurse specialist, your educator on your unit. And that's how we provide all of those elements within that first year of the program. All right, so this is just a snapshot of what our numbers of our program, and it's happy to see that we've been growing quite a bit within the last few years. Just initially looking at our 2018 numbers, we took in for the whole year 20 nurse residents. And now if you look to the last fiscal year of 2021, we finished the year with 169 nurse residents in the program. And then if you look at that retention rate, we're really happy to say within from 2018 and on, we've been able to maintain or retain our nurses above the national average, above 90%. So it's really happy to say that. So we want to be able to keep our nurses. And then, so we have, if we look at FY22, we already have 104, and we're looking to hire more than about 200 maybe within the next year. Okay, so now I said we are growing in numbers and we're growing in different areas of the hospital that we haven't been able to offer before. So something that's unique to Stanford is AAU, the term that you'll see here for medicine and surgical. It's acuity adaptable unit. So in these areas, we're able to provide care to our patients in an adaptable way, where if it's a medicine patient and their diagnosis and their needs and care are in the medicine area, they can be able to stay on one unit. If an acute level of care all the way up to an intermediate level of care. So that's what you'll see here at Stanford. So we have nurse residents in the medicine AAU, surgical AAU, critical care. We have oncology. There's 6 different units with oncology. We have BMT, bone marrow transplant. We have oncology, general service line, and we also have hematology. We take nurses into the adult emergency department, inpatient float pool. Those float pool nurses float to oncology, the medical and surgical AAUs, and also the psychiatry areas. Inpatient psychiatry takes care of 2 specialties of inpatient voluntary and involuntary areas, but it's under the same umbrella. Clinical trials is an exciting new department that we have. It's under the nursing research umbrella of the hospital. So we have nurses who are trained to take care of patients in undergoing a clinical trial, whether they're being admitted to start a new medication or they are coming into a department and are already on a trial. We will send over a nurse from the clinical trials department, and they are trained to and specialize and be able to facilitate that. They don't actually perform clinical trials, but they're able to provide the care and have a better and deeper understanding of those trials and what it entails. Those nurses, if there's no clinical trials going on in the hospital at that point in time, they'll actually join the supplemental staffing department and float out to different areas of the hospital, similar to float pool. We have the peri-anesthesia area. So it's the preoperative and the post-anesthesia. And so those are one department. The nurses that enter that area will be trained in both pre and post-op care. And then, but it's under one umbrella, similar to the psychiatry areas as well. Okay, so we want to provide you this snapshot of the cohort timeline. So it goes from April to August. And we want to point out some critical areas. And what's important, why we want to share this is because we have a lot of feedback. People apply, and let's just give you a date of April 20th, and you apply for to join our residency program. You don't hear anything back for quite some time, but we just want to show you the process. So in April 18th to the 29th, you'll be able to apply to the program. You will follow one link for a clinical nurse 1 posting. You enter in your application, you submit all the required documentation that we'll go over shortly, and then that will be on for 2 weeks. Within the next 4 weeks after the posting, our team will be screening applications. What that means, we're reading all of your documents, we're making sure all of the requirements are met. And then after that screening takes place, we go through panel interview preparation. So what that means is now everyone's moved to a screening list, a screening bucket list of like, okay, they were screened, they met all the requirements, and now they're in line for interview. So we then go through the process of where you sit and how we can put you in panels and get all that ready and get all the players involved of who's going to facilitate all of these interviews. And so there's a possibility that, yeah, you apply on the 20th of April or maybe the 18th, the first day, and then all the way until maybe in the middle of June, you haven't heard anything, but that's what's going on. It's important to make sure that we pay attention to that April 18th date and the April 29th date. Yes, you have 2 weeks, but I would strongly advise you not to wait till the last minute to apply, as there's sometimes technical issues or things that you're not sure how to navigate through, and you may reach out to HR or the numbers given there, the resources, and you need to be sure that your application gets in by that ending date. Otherwise, you risk not being able to be a candidate because you missed the deadline. So when we look at the panel interviews, we have 2 weeks there, June 20th to July 1st. The first week of that window includes us doing panel interviews. So you will be on a panel interview with members of the leadership teams of the section that the areas of that you're applying for. If that unit manager sees that you're a fit for their unit and for their team, they will invite you to a unit level interview the following week. And if you are really a fit for the unit, they will submit their list to HR, and they will reach out to you with offers from that first week of July out until August. So this is really important for you to know this map here or this calendar and pay attention to these dates. That way you know what to expect, you know what may be happening should you be eligible to be not only moving into the screening process, interview process, what dates and window that is, and then for the start date would be August 27th. That would be the start of this cohort. Okay, so let's go over some of these application requirements. These are the 4 areas that you would need to meet before you can apply for the program. And I think the first 3 are pretty, I think you're all here because you most likely fit that criteria. So first of all, we must be a graduate of an accredited ADN, BSN, or MSN program, or an accredited online program. You should have no more than 6 months full-time experience as a registered nurse. What that kind of, a lot of questions that we get into this area of what is considered full-time, and when do you exceed the amount of time? So you take the amount of hours that would be considered full-time, you times that by 6, and what the number would be. If you exceed that number, you wouldn't be able to apply to the program. So if you're working a part-time job, you add up all the hours that you've worked, and if it's less than that number for full-time for 6 months, then you'll be able to apply. If you exceed that, then that would exclude you. So I would think just pay very special attention to how many hours you're working and where you sit in that timeline. We ask for official graduation transcripts no greater than 18 months from the cohort start date. So this cohort is starting in August 22nd. So we would need your graduation date to be no greater than 18 months from that date. And then you would need to submit all required application documentation. We're going to go over that a little bit more in detail. So you must submit a cover letter. You must submit transcripts, official or unofficial. If you're still in school, you can submit unofficial. You could submit unofficial, and it would just show us that you're still in progress. You can complete an electronic application that we just discussed earlier, and a resume. So resume, we're going to go over a little more detail in a next couple slides, but within that resume, you must have clinical rotation, location, hours. You will have 2 references, and you will have work experience listed, nursing intern and externships listed, military experience, and volunteer experience. The reason you see these in bold red is because these are all going to give you points in your application. So we don't give points for cover letter, transcripts, or your resume, although they are required, you must submit them. Where your points lie in this portion is your work experience, any nursing intern or externships, military experience, volunteer experience. Okay, so we're gonna review a cover letter item. So a cover letter introduces you to an employer through a personalized explanation of your qualification and interest in a position. While a resume shares the technical details of your skills and work experience, a cover letter gives insight to your soft skills, attitude, and motivations. Employers use cover letters to get a sense of who you are and how you would use your experiences to accomplish the requirements of a position. So you may choose to share the following in a cover letter. We've had applicants share why nursing, why they chose nursing, what motivated them to be in the profession. You may share what have you done and overcome to get to this point in your nursing career. You can also share what makes you uniquely qualified for this role. So you can use accumulation of all your experiences, personal experiences, clinical rotations, educational training, work experience, volunteer experience, military experience, etc. So all of these experiences that you've had make you uniquely qualified, and everybody's story will be different in that cover letter. So we've had people share that. You can share why Stanford, why are you looking, what are you looking for in an organization? What can you offer this organization, and how are your values aligned? You can share what you plan to do in the future, what you plan to accomplish. You can let your resume speak of your past experiences, and your cover letter can summarize your future goals, right? So your resume is going to show what you've done, and your cover letter is going to summarize all your goals, right? The main purpose of cover letter is to support content of your resume. Your resume focuses on your qualifications and your achievements, and your cover letter expands on those. It showcases your personality and explains why you're a good fit for the company. Okay, so we mentioned our resume a little earlier, but we want to go into a little bit of of depth and give you some details of what you need to include. So a resume provides a summary of your experiences, abilities, skills, strengths, and accomplishments. It states relevant information regarding your education, experiences, and job-related interests. It demonstrates what you've done in the past and how it should align with your qualifications, the job you're seeking. It's your personal marketing tool and allows you to communicate your assets and potential to the potential employer. You have to think of it as an advertisement, right? It's advertising all your unique skills. It's showing your qualifications, stresses the benefits that you have to offer. Don't think of it as bragging, right? This is like your time to share and show what you've done and, a variety of things. So don't worry too much if it has a lot of different, like, oh, this doesn't match. It's different than, being a nurse, but we can draw from all of that. And it's good to just show that flexibility and the depth of, what you've done so far. So when you fill out your resume, we want to see education. Included nursing education, the school and date of the program completion. So you can make sure you highlight those. You can include non-nursing degrees. You include the school you went to and the date of the program completion if applicable. We would want to see your clinical rotation. So you must put a listing or a table, a little chart of your rotations, including your nursing curriculum associated with that rotation, the location of the clinical rotation, and the number of hours of the rotation. So make sure you highlight that. Again, this is the part where we're going into how you get points. If you have these items, if you have these experiences, we definitely want you to share them. If you don't share them, we don't know that you have it. So definitely make sure you highlight these: work experience and military experience. You want to include your job title, your role, the employer, time of employment, and your roles and responsibilities. So that's for work and military experience. And when you include your roles and responsibilities, even if it's not a healthcare position, you can still highlight your roles and responsibilities as they relate to the nursing role. So if you worked at a Starbucks, you would put you were a barista at Starbucks. You worked there from April of 2020 to July of 2021, and your roles and responsibilities were, you made drinks, you handled the cash register, you had to provide service recovery if a drink wasn't made correctly, you motivated your team, you were able to pitch in and provide a positive team environment. Those are the things that you can pull in. Yes, they're not directly related to a role of a nurse as per se, the title or a healthcare related position, but the skills that you have developed and the abilities, your strengths that you developed in that role will definitely help you in a nursing role in a team environment. Volunteer experience. So we want you to include your volunteer title or your role, where you did this as volunteer. So what agency and who your supervisor was, and the numbers of hours volunteered. I want you to focus on the number of hours here. This is how you are scored on the volunteer bucket. So if you're not sure, we want you to go back and kind of get your best guesstimate, maybe contact whoever it is at the agency and see if they have a log or something in a database that you can pull from. One thing we don't want to see is the time that you were there. I would love to see the time you were there, but where this is going to pull in for you is going to be the number of hours. So if you have those, you could start drawing from them. Nursing internship or externship. So we want you to put, if you were a nurse intern if you were intern or extern, your title and your role, who your supervisor was, where the agency you did this, and the time of the internship, and your roles and responsibilities. When we look at talking about a nursing internship or externship, it's important to highlight that it is outside of your degree. So it's not related to the requirements for your degree, and it's not associated with any clinical rotation. Okay, so we get to, you've covered your cover letter, your resume, and now we are at the electronic application. So when you first log in to do the electronic application, you fill in your demographics, which is general information about yourself. Where did you hear about the position? And also if you're willing to commit to a 1-year commitment. Okay, and then you go over to specialty ranking. So when you go over to specialty ranking, you're going to be asked to rank the following specialties in order of preferred work. So when you apply to the one link for the clinical nurse 1 position for this program, you're applying and you're not applying to, oh, I want to work in the ICU, I want to work in PACU, I want to work in surgery. You're applying to one clinical nurse 1 position. And then you also are going to rank your preferred work setting in the order of 1 to 8. So which one you prefer the most is number 1 down to number 8. And that's how you will be applying, and that's how you'll be placed. Our goal is to place you in the top 2 preferences of your choice. So definitely take some time to think about that. But that's how you're going to be placed in your area of preference, is by ranking 1 to 8. And then we use our rubric system there. Okay, and so after you have put your order of preference in your ranking score, you answer electronic application questions. So you're required to answer 4 questions. Each question has multiple components. You'll be required to answer all components of the question. The length of the answer is up to the applicant. We accept all answers regardless of the length. Okay, so we're going to look at these questions a little bit. Oh, sorry, there I skipped it. So here are the questions. These are 4 of the questions that you're going to be asked. You can see that there is 3 components to each question. Those are those components we talked about. There's a story, what was the result, and how it's changed your practice. And we have a rubric to discuss this. So I'm going to read one of the questions here. Is tell us about a time during your clinical rotation when you experienced a caring moment with a patient. How did this moment affect the patient's outcome, and how has it changed your clinical practice? So we have the story. Tell us about a time in a clinical rotation when you experienced a caring moment with the patient. We have the outcome. How did this moment affect the patient's outcome, and how has it changed? And then the third component is how has it changed your clinical practice? So we have a rubric when we score these questions. We will first see what was the experience. Did they share that? We will share, was there an outcome? And then how has it changed their practice? So when you're looking at a question where we put the score into the rubric, is we're going to look like this. So we already have the experience, we have the outcome, and how has it changed your practice? So we can look at the second question. Tell us about a time you had an error in judgment. Can be personally, professionally, or academically. What happened? What did you learn from this experience? How has this experience shaped you into the nursing professional you are today? So we have the experience. We had the outcome. And we have how has it shaped you into the nursing professional that you are today. So think about these questions. We have them here. You can take a look at them. You can take a snapshot of this. And really start to think about if you've had an experience of this, how has it changed you? How have you incorporated it into your practice? And chances are, if you remember a time like this, then you will be able to answer the question effectively if it kind of sticks out in your mind from your clinical rotations. So we're going to go into a little bit of the depth of this. So here we are with the question number 1 again. Tell us about a time during your clinical rotation when you experienced a caring moment with a patient. How did this moment affect the patient's outcome, and how has it changed your clinical practice? So part 1 is tell us a time when you had a caring moment with a patient. So it can be you sat with a concerned family member, you stayed with a patient and offered comfort during your procedure, you took a patient on a walk to the garden, you washed and styled the patient's hair in anticipation of their family visiting, you offered tissues, held hands, sat close to a lonely patient, you made a patient laugh during a stressful time. So that's part 1. That's some experiences that we've had submitted to you. That's something that you can share. Part 2, how did this moment affect the patient's outcome? So it could be the family member felt relieved and calm, patient felt supported and comforted, and verbalized the procedure was much easier knowing I was there. The patient verbalized feeling refreshed and beautiful and was smiling when their family visited. The patient told me stories about their travels, laughed, and thanked me for sitting with them. Or the patient said they haven't laughed that hard in a long time. So part 3, again, highlighted, underlined, what we want to see is how has it changed your clinical practice? How were you able to take this experience and carry it on to your now practice, what you think about when you're now taking care of patient. So what did you learn from this interaction? How do you do differently now? Is compassionate care now a proactive part of your practice rather than a reactive part of the practice? So now you go in with that in mind of having to be wanting to be compassionate to this patient rather than, oh, this is happening now. Now I want to do something for the patient. What did this moment teach you about the human to human connection? How has your viewpoint shifted from patient-centered care to person-centered care? Do you now incorporate the family as part of an essential part of the team? Okay, so we have an example for you here. This is a full example of meeting the three components of a question. So again, the same question about a caring moment in our clinical rotation. How did the moment affect the patient's outcome, and how has it changed your clinical practice? So during my senior preceptorship, I was caring for a post-lung transplant patient who had a very complicated surgical and hospital course. The patient had a trach and was not able to speak audibly. Despite many attempts with the speaking valve, it was apparent the patient could not tolerate the speaking valve and therefore relied on writing on a whiteboard to communicate with his providers. I had the opportunity to care for this patient multiple times and always found him extremely cooperative and motivated in his care. On one shift, I noticed he was more withdrawn and a little less engaged with his plan of care. I inquired if everything was okay, and he wrote, "I'm feeling frustrated." He continued to write that he met his wife on the 16th of February, 1968, and since then he has brought his wife flowers on the 16th day of every month. He knew that tomorrow, March 16th, he would not be able to continue that tradition. In that moment, I came up with a plan. I told him I would bring flowers tomorrow so he can give them to his wife when she arrived. I gave him a blank piece of paper and some colored pens and asked if he wanted to write a handwritten card. He immediately smiled and wrote, "You bet I do." His whole face lit up. The next day, when his wife came to visit, he presented her with the flowers and a card, and she immediately burst into happy, grateful tears. The patient was genuinely happy and expressed gratitude for this thoughtful gesture. He said it made him feel seen and cared for, and helped him recommit to his recovery. This caring experience taught me the power of small acts of kindness, the importance of taking the time to recognize your patients beyond their disease process, and how important it is to care for the whole person so they can show up fully to their recovery. Since this moment, I have committed myself to seeing the human spirit in each patient, and in doing so, I have embraced each patient as the unique individuals they are. I connect with each patient, ensuring that I can call them by name, by their preferred name. I proactively involve them in their care, sharing with them goals that the care team has for them, but also ensuring that we acknowledge the patient's personal goals as well. I respect their preferences and validate their concerns. I make no assumptions. Above all, I foster a relationship built on trust, kindness, and genuine care for my patients, with the hope that they know that I am here to care for them as people, not just patients. So this is an actual submission that we received. They answered component 1 of the experience. They answered component 2 of the outcome and the response of the patient. And part 3, what did they learn? They answered it and they exceeded our expectations. They told us exactly what they did and how they now integrate it into their care. Okay, so we have some general FAQs here. Is a cover letter required? Yes. How long should a cover letter be? It could be any length and format that you choose. I just answered the other question. Who should I address the cover letter to? You could address it to Stanford Health Care. You could address it to whom it may concern is the most general, and we'll also accept that. Does Stanford read each cover letter, or do they use a software application to scan for keywords? No, we read every single cover letter, resume, your answers to your electronic application. And that's hence why we showed you that timeline, so you get an idea of how much we're covering in those windows. Should my cover letter target a specific position, specialty area that I'm interested? Yes, you should. If you really feel passionate about a certain area, you can write that letter and highlight why you would be a fit for that area. Should I share my work experiences even if they are not healthcare related? Most definitely. If it's not healthcare related, it's still skills and strengths that you've developed, and you can build upon them, and you can use them to apply them to being a nurse. Should I share my senior preceptorship experience, even if it was not in adult medicine? Yes, you should. You could share any experience that will apply to the setting. Should I share why I think I would be an asset to your organization, or does this come off as bragging? So it doesn't come off as bragging. It's important because it's you. What makes you you? What are you going to bring? And I think it's not bragging. It's just sharing your skills and being your own personal advertiser. Is a resume required? Yes, it is. How long should a resume be? Any length or format? How should I format the clinical rotation information? You could put it in a list, just an organized list, or you could put it in a table so it's clearly listed all the elements that we're asking for. What do I put if I am still completing my clinical hours? You could put in progress. Do you give extra point for attending certain schools, GPA or degree? So if you went to an ADN school, you had a 4.0 and you got and that was the result, you get the same points as if somebody went to got a master's degree and they had a 3.0. It's as long as you meet the requirements, you get all the same points. Do you give extra points if you had a clinical at Stanford Health Care? No, everybody is the same. Should I list non-healthcare related work? Yes, you should. Is all volunteer work acceptable? Let's see here. It should be, oh no, I'm getting mixed up. Kerry, can you answer that one? I think I wrote down the wrong.
Which one are you on? I was answering in the chat. I apologize.
No, it's okay. The volunteer,
Yes, all volunteer work is acceptable. So if you are a soccer coach or you worked with a homeless population or you volunteered at a hospital, please share that with us. And the recommendation is you share volunteer work that is recent, so that you've done in the years that you were in your nursing program.
Thank you. Okay. All volunteer work was considered an internship or externship. This is the one I wanted to make sure I wasn't mixing up. So an internship, an externship is a, internship or externship that you were part of that is not related to your degree or clinical rotation. It could be unpaid or it could be paid, but it needs to be nursing related. So that's what we look for in that, as to where all volunteer work is accepted, but for the internship, it needs to be something that's related to nursing. It could be paid or unpaid, and not, the main one here is it cannot be connected to your school, your degree, or anything that is part of your clinical rotation. Should I provide my RN license information? You may put it in your resume, but it's not required. Do not upload it. You don't need to upload it. Should I provide my BLS and ACLS? You could put it on your resume, but it doesn't need to be uploaded. Can I list other elements on my resume, such as skills, certifications, accomplishments? Yes, you may. Can I apply before I graduate my ADN, BSN, or MSN? Yes, just make sure you put in progress for anything, or you can put the anticipated graduation date. Can I apply before I have my RN license? Yes, you may. You just need to make sure you meet all the other qualifications. When do I need to have my RN license by? I'd like to refer to my HR colleagues that are logged on. I think it's Carly. So I make sure I give the right date here.
Carly, do you have a recommendation for when, for cohort 37, the August cohort, when they would have to have their official California RN license by?
I would make the goal to have it no later than Monday, August 8th. That way we have time to verify it and everything through the Board of Nursing.
Thank you.
August 8th. Okay, can I choose my specialty area to work? Your specialty area, like we said there, you're going to apply to one link for the clinical nurse 1 position for this nurse residency program. And after you submit the demographic information, you're going to go to specialty preference, and you're going to rank them in areas 1 through 8. Now, depending how we place you and are able to put you in an interview panel, how our scores are looking, that's how you're able to choose, but you cannot apply to a specific department. It's you rank your area of preference, and then that we go from there. What is the interview process like? So we have, if you are placed in a panel, We have 5 candidates that are invited to join, and we have the area managers on the call as well. And we give you behavioral style interview questions. And then we ask everybody the same question and you reply. There's not a lot of room for discussion or any dialogue there, but that's how our interviews are processed, and it's in a behavior style. How many people are you hiring? I believe we're targeting, Kerry can step in if I'm wrong, it's about over 100. So yeah, okay. And then if I've applied before but was not selected, can I apply again? Yes, you can.
So Letty, just before you move on, we've had a lot of questions in the chat regarding letters of recommendation versus references. So this is a change to our application. We are no longer requiring letters of recommendation. With our last cohort, the feedback that we got, it was very difficult, especially with COVID and all the modifications that students had to go through with their clinicals, to get 2 letters of recommendation from clinical faculty. So we are not requiring, you do not need to submit letters of recommendation. We are asking that on your resume, you have an area that lists references, and 2 of the references that you provide are faculty from your School of Nursing. They could be a theory professor or a clinical instructor or both. You are also welcome to list additional references should you want to. So potentially that could be a preceptor, maybe you are an employee somewhere and want to list a supervisor, you are welcome to do so. We are not requesting or sending out any sort of electronic documentation to those individuals who you have listed as a reference. Should we need to contact your reference, we would do so by phone and have a conversation, but we will not contact them and ask them for a letter, and we would not send them any sort of electronic format or survey that they will have to fill out. Thanks, Letty.
Yeah, thanks, Kerry. I think we're gonna go to the next slide, and I was gonna get it there, so you guys are on point. All right, so important application reminders. We have an application checklist. So you want to make sure that you submit a cover letter, a resume that includes educational information, your list of your clinical hours, your list of references, which is changed from the letter of recommendations, your experience. So what work experience, military, intern or extern, and volunteer experience if applicable, transcripts, official or unofficial, and completion of electronic application. So that's your checklist to make sure you meet all the points that are required. Some reminders of things that are not to be submitted. So you do not submit your RN license. You can include it in your resume. Do not submit BLS or ACLS. You don't submit any additional certification, and you do not need to submit any letters of recommendation. You apply one time. If you need to modify your application or upload any documents, please email newgradrn@stanfordhealthcare.org. What happens if you apply more than once is you keep making a new profile. So if you forgot to include something in your resume and you were still within that window that you can, you could still apply, and rather you should email newgradrn@stanfordhealthcare.org rather than going in and submitting another application with that included, because then that gets us into an area where we can't differentiate which application you were intending to use. So we want you to make sure you only apply one time. Again, keep in mind you don't want to wait till the last minute. Late applications will not be accepted. So keep that in mind, get that calendar out of the dates that the application will open and close. Look at your personal, your work schedule, and plan out the days that you want to submit that. That way, if you have any issues, you're not going to wait till the last minute and just figure out that you had to work. You didn't really consider that when you were going to submit the application. You're having issues and now you missed the deadline because you didn't have a good window to apply if there were any issues. You want to anticipate that. Please use one identifier that remains consistent on all documentation. So on your resume, your transcripts, and your application information, I could use myself as an example. My formal name is Leticia. My shorthand, it's Letty. So I can put, if you want in your resume, I say Letty Cortez. On my transcripts, it says Leticia. And then on my application, it's it could be it's spelled Letty a different way, right? We want to make sure that everything you use to identify yourself is consistent on all your documentations. That way there's nothing to assume or we don't know. And if you made different profiles and different names, we want to take the application that you intended to submit. So we don't have to take from the one that's the most complete and that might be missing something or not have all the required documentation. Okay, and then we have to, you have to answer all 4 application questions. Do not leave them blank. And then you want to answer them completely, meeting all 3 components of the question.
Okay. I'm going to interrupt you one more time. We have some more information in the chat. So a couple things. The application remains the same. So if you have applied before, it's going to have the same format. Stanford has one application for all of their job roles, meaning I can't create a new grad application form. So the reason we have this checklist is because when you go in to apply, you will see an area that says upload certification, upload licensure, upload BLS, ACLS. We are telling you, you do not need to do that for this program. It causes a lot of anxiety because individuals go to apply and then they see that and it catches them by surprise. So they close the application, reapply, then have duplicate applications because they feel like they were missing something. You are not missing anything. Submit a cover letter, a resume, your transcripts. Those are the 3 things you will upload, and that's it. You don't get any extra points if you submit an RN license. You don't get any extra points if you have a certification. You don't get any extra points for BLS, ACLS. So don't worry about that. Simply come with those 3 documents and then complete the electronic application. Thanks, Letty.
Thank you. Okay, so our next slide, we're going to be going over and we'll have Carly, you want to take over? Just tell me when you want me to switch the slides.
Okay, no problem. I saw a bunch of these questions coming in the chat too, so hopefully this answers everyone's questions. Starting pay here at Stanford is set in stone. You start at a rate of $72.64 an hour. That is in addition to shift differentials, which are based off of your shift. There is no room for negotiation. This is the starting rate. We are a union hospital, so these are pay grades that are set forth by the union. For relocation, we do offer, for those outside of the state of California, we do offer $5,000 to be put towards your relocation costs. That is paid out in full on your first or second paycheck once you've started here at Stanford. We also have a rental housing program that helps you find leases on apartments, condominiums. And then we also have a program that we've just started called Landed that helps those relocating that want to purchase a home. So just different things there that can help. And it's effective immediately once you start accruing PTO. So during your first year, you will receive 36 days, and that includes holidays. Letty, next one. And then also effective, so for this cohort, you'd be starting August 22nd. So effective September 1st, these benefits would all be eligible to you. They're eligible as well to your spouse, your registered domestic partner, and your eligible children up to age 26. We offer 3 different medical plans for all of our nurses, as well as dental, vision, healthcare flex spending accounts, virtual care, just kind of the basics, but you do get them effective basically within 2 weeks of starting. We have a little bit more of a breakdown of this. I can also email to anyone that's relocating that needs a little bit additional information. Letty, you can go to the next one too. And this is just additional benefits. We have our short-term, long-term disability A&D benefits, and then we also offer a 403B savings plan for retirement for those of you that are already thinking about it. After 1 year of service at Stanford, we start matching. You can be eligible for up to 5% matching. And sometimes once you've had so many years of service, we do match up to 8%. But that is effective after 1 year of employment here at Stanford Health Care. All right, Letty, your turn.
I'm gonna have Kerry take over on this section.
Okay, so Letty, if you could stop sharing your screen and we'll open up to the floor. I love seeing all of your faces. So if you are not on video, I invite you to come on video. I'm really excited that I have all of the nurse residency program coordinators on this call. Carly is our HR colleague, and then there are 3 nurse residents. One has recently graduated from the program. Alina is on this call. And then Gavin and Daniel are also on this call, and they're in our current cohort 35, which is about 9 months into this program. So I'm going to ask each of them to introduce themselves and to share with you what made them successful in the application process. And then I will open it up to all of you to ask them questions, those burning questions that you have about their experience applying, interviewing, and then transitioning into practice at Stanford. So Alina, I'm going to put you on the spot. If you could introduce yourself and share with the 292 friends of ours on this call, how you were successful in your application process.
Hi, everyone. My name's Alina. I'm currently working in the observation department at Stanford. I just graduated the residency program this month. It's a very stressful time applying. I just want to acknowledge that, and you guys are all doing so well. I think what made me successful in my application is I put so much effort into the answering the prompts, like the written prompts. I had a whole Word document, and I thought a lot about each question and really reflected on the meaningful moments in my experience in nursing school and in my experience, like work experience as well. And in my interviews, I really tried not to focus so much on, like listing my achievements and listing what I've done, because ultimately my resume tells that story anyways. And I feel like everyone applying are very capable people. So I really focused on trying to make my kind of more like soft skills personality come through in the way that I answered the questions versus just listing, the things that I've done. And yeah, I feel like just framing it all like a conversation and being confident and focusing more so on what you can give to patients versus all of the things that you've done and who you are as a person is really important in this. I think everyone on the interview panel looks at the applications in a very holistic way. And I'm sure that each person here has a lot to offer. So just let that shine through when you talk about yourself.
Thanks, Alina. Daniel, can you share with the group, introduce yourself and share with the group your process?
Hi, everyone. My name is Daniel. I work in oncology, and it's been 9 months since I've started the new grad program, and I love it at Stanford. I think everybody around me is very supportive, and Kerry and Letty and the NPDSs have really helped me develop as a nurse. And so I think that's one of the things I really like. And a little bit about myself, I went to San Jose State, so I'm local in the area, and just started at Stanford, like I said, 9 months ago. Similar to Alina, something that made me really successful in the application period or process was, I think, preparation. I think I spent a lot of time working on my resume and my cover letter and, answering the prompts and the questions. And, I went to one of these Zooms at the start of the application process, and I saw some of the prompts that were presented, and I was still in my preceptorship clinical at the time. So yeah, I really tried to look for those patients that were meaningful to me in my preceptorship. And when I went home, I wrote down what happened just so it was fresh in my mind. So later when I was ready to apply, I had some of that information already down in like a Google Doc or something. And, just going through some of the things that happened to me during preceptorship, some of the, and then clinicals also, all the patients that I've had, and really just taking my time, writing the story down and making it coherent and cohesive. And I even had, a couple of people look at my documents and my prompts just to make sure it flowed well and it made sense and stuff like that. So, putting that time in and preparing before you submit the application is really important, and give yourself, enough time. That way, if something does happen or something changes or someone asks you to make some changes, you have time to kind of go back to the doc, and you don't do everything last minute. Obviously, it's very stressful during the application period, and you want to make sure everything's perfect, but give yourself some time, that breathing room. That way you have time to make changes. And then, like Alina said, during the interview process, I use some of the same stories that I use on the prompt. So it's easy in that way. but really highlighting your personality and, your soft skills. Obviously, the managers know that you're a competent nurse. You went through 3-4 years or 1 year of nursing school. Oh, sorry, my Siri activated. But yeah, the managers know that, you're competent, you're smart, but, the soft skills is something that they're also really looking for to see if you're a compassionate nurse, if you care about your patients, if you're willing to learn on the fly, and if you're a good fit with the team there, right? So just highlighting those aspects of your personality, I think that's really important during the interview process.
Thanks, Daniel. Gavin, can you introduce yourself and share your experience with applying?
Yeah, hi everyone. My name is Gavin. I work on J2, which is the cardiothoracic ICU at Stanford. I'm in the same cohort. I've been in 9 months on this new residency program. I can definitely remember when I was applying. It was super stressful, but just take like you said, just take your time, kind of reflect. I think my best advice for everyone is to kind of reflect on everything that you've had here at Stanford. I know that the biggest thing really is who you are, all the technical skills that you'll have the opportunity to learn. And so, but the soft skills and what kind of nurse you'll become, that is kind of what they're looking for and what we're taught every day. We're taught to be compassionate, to care, to provide individual care. And so I think you can pull that from any type of experience that you've had. And that's kind of the biggest advice I have for everybody.
Thanks, Gavin. Okay. To all of you out there, this is your time. Ask away. We know you have those questions. Feel free to come off mute.
So one question I have is, what does as a new grad, I'm assuming it's kind of aligns with a full-time hourly, weekly per hours. And I was just wondering what that looks like towards the beginning versus the middle versus the end. Are we starting off out of the gate, doing clinical hours, preceptorship, and mixing in classroom time? Just a kind of a general idea, so I have it in my head.
Alina, you want to answer that?
Sure. So the first week, I believe, is all, I'm not sure if you're doing it on Zoom or in person this time around, but for us, we were doing it all on Zoom. The first week was all like classroom time and orientations and onboarding, just like any other job would be. And then starting the second week, you're hitting the ground running. You're basically doing your 3 shifts a week, whether it's night shifts or day shifts, and you're with a preceptor. Depending on what specialty area you're in, the orientation times do differ from 10 weeks to some
18.
18 weeks in the ICU. So it depends where you're going to end up. And then every month we have a seminar where we all get together, again, either in person or on Zoom. And those are full day, 8-hour seminars. That same week that you have the seminar, you'd probably work 2 shifts or 3 shifts. One of them's like shortened on the floor as well. So then it becomes kind of mixed classroom and clinical time. But for the vast majority of the time, it really is just clinical time working on the floor basically right away.
Thank you, Alina.
Jasmine, question from you?
Yes, hi. Well, first of all, thanks for hosting this information meeting because it's kind of overwhelming. So it's helpful to kind of see the kinds of things we have to do to kind of guide us to apply. But I guess my question is, earlier in the chat, I put in a question about experience. So, I mean, I'm pretty sure a lot of nursing students were really busy during nursing school, and, I'm not sure if this is the case for everybody. I know everybody's different, but I didn't really have a lot of chance to volunteer during nursing school, but I had an employment job somewhere as a medical assistant, and I had volunteer experience at different hospitals before nursing school. So I was wondering if I'm able to use that as experience.
Yeah, I would say so. I think you want your resume to be relevant and recent, right? So if you feel like you're dating
Yeah.
yourself pretty far, I would encourage you not to do so. But if you were volunteering
Yeah.
during your prereqs, if you were working before you went into nursing school, especially if you did an accelerated program, we know there's not a lot of room to do a lot of things when you're in an accelerated program.
Yeah.
That's totally fine. But if you're like dating like 10 years ago, worked at Baskin Robbins.
No, not that long ago.
Yeah. So I
Yeah.
think of like, what was I doing this at this time? Was this in anticipation of going into my nursing program? Absolutely.
Okay, awesome. Thank you so much.
Andrea, a question from you.
Hi, my name is Andrea. I'm from Houston, Texas. Yeah, I just wanted to ask the students on the panel, what is y'all's favorite part of nursing school, or not, sorry, excuse me, I'm in nursing school, Stanford's nurse residency program.
And don't everybody respond at the same time with all the things you love about it. Go ahead, Danielle.
I think one of my favorite parts, obviously, is like the emphasis on learning and development that's placed at Stanford. You know, I think Alina mentioned once a month we have a seminar together where we come together and various speakers come and present on, you know, different topics. And, you know, it feels like every month I'm learning something new from those seminars, and not only from those seminars itself, but also, you know, being on the floor and dealing with complex patients and complex situations. You're challenged to kind of think outside the box. And, you know, obviously you learn a lot of stuff in nursing school, but I feel like there's some stuff that maybe we didn't focus too much on in nursing school. You know, I'm in oncology and in the cancer department, and we didn't really talk about a lot of oncology in nursing school. So I feel like when I'm working, you know, I have all this base of nursing knowledge from school, but now I'm asked to learn even additional things, right? And so I think the emphasis on learning and career development that's one of the things that I really love about this nurse residency program.
I really enjoyed my time in the nurse residency program and like going into, you know, transitioning out of that too. My favorite part of being at Stanford specifically, I went to school on the East Coast and I worked as a tech there, and I obviously saw how the hospitals there work during my clinicals. And at Stanford, I feel like I am always very, very supported both by my team on my unit, but also by Kerry and like all the new grad people. If I ever have any kind of questions, I can always reach out for any kind of support that I need. And I feel very privileged that I think in California in general, but in Stanford in particular, like I've never felt unsafe in like treating my patients. I've never felt like I would like cause harm to my patients. I think it's a very, very supportive learning environment. And it is an academic hospital. So I feel like questions are always very welcome. And that just, I think, fosters a great environment to, you know, build your skills.
And Gavin, thoughts from you? Favorite part?
Well, it's a tough act to follow, but I think my unit in particular, not just everyone from the physicians and the advanced providers, but also just the nursing staff as well. Your float nurse, your charge nurse, your peers, they're very, very supportive. And you'll never, even when you're by yourself, when you no longer have a preceptor, you can feel free to ask anyone for a question, all the way down to our unit secretary, our NAs. Basically, anyone on our unit is available to you at any time as long as you ask for it. And that's one of the luckiest thing I have, and the most precious thing that I have on the unit.
Thanks, Gavin. Asuna, a question from you.
Yeah, so I was also wondering, so oftentimes when we see different programs, we have to understand how we are able to connect our values and find common ground in order to truly work together. So for all of you who are currently at Stanford, what are the major core values that you carry, not only in terms of Stanford, but for yourself as well?
Alina, Daniel, Gavin. Daniel?
Yeah, I can answer. I think one of the things that I really valued in a nurse was compassion. And, I really thought, in nursing school, I thought I was the advocate for the patient, right? And so oftentimes I'm the only one standing between the patient and the doctor, or like the patient needs total care, and I'm the only person that can advocate on behalf of that patient. And I think that advocacy and that compassion was something that I really wanted to highlight in my application and during the interviews, and something that I really value as well. So, being that patient advocate and standing up as a patient, even when, maybe people around the patient are not really believing what the patient has to say, and being that bridge between the patient and the physician, and even the patient and the family, or the patient and the case manager, and advocating for the patient, and realizing that, the patient is in very difficult situations, and putting yourself in the patient's shoes and realizing, I'm the only person sometimes that can make sure that this patient is comfortable, or this patient feels safe, right? And so I think that advocacy and that compassion was something that I really valued in myself, and also highlighted in my application.
Thank you.
Another trait that I think would be super important is resiliency. You will, and we have all gone through really difficult times, difficult patients, difficult emotions, difficult times. And it's important to be able to understand yourself and to take care of yourself, to be able to come back the next day, next week, and to be able to carry it on, because you are the one taking care of them, taking care of the patients primarily. And so you also need to take care of yourself and be able to do it over and over again.
Oh my gosh, I could not agree more with what Danielle and Gavin said. That's so true. And it's really wonderful that Stanford and this new grad program allows us, at least the new grads, like the space to process those emotions and build resiliency as well. I wanted to add another value that was really important to me was teamwork. And nursing is a team sport. And I think that's been like the best part of it for me, is just being part of a team where everyone's goals are, aligned, taking care of a specific patient. And even if people disagree on like some small, operational things, everyone is very aligned in what they want, and everyone is extremely supportive of each other, and really builds each other up, from my experience.
Hey, thank you guys so much.
Rebecca, a question from you.
Hi, yes, I was very curious to hear about your experiences with the panel interview. I've never done one, either in person or virtually. So I was just wondering like what it was like, and how you might feel you did in the interviews in order to become like a primary candidate for the units that you were ultimately hired into.
I can answer this one. I will be honest with you, it was extremely nerve-wracking. So whatever emotions you have about it, it's totally fine. There are some panels from my cohort mates. They've said that there are some panels that all 4 panelists were invited to interview for the second interview and get a position. And in others, there were maybe only 1 or 2. I think that the panel interview is a great opportunity for you, especially if you're nervous. You kind of get to hear what all the other panelists are saying and get a moment to kind of calm your nerves, think about the question. The way it works is the panelists will ask you a question, or ask the interviewers, interviewees questions, and you'll each take turns rotating who goes first. And you'll get a moment to kind of think about and process the question. And so it is scary to think about, but once you're in it, it'll be a lot easier to kind of manage your time.
Yeah, the panel interviews were very scary, I'm not gonna lie. But once you're in it, I feel like if you're well prepared for them, like I practiced answers to interviews so much. Like I would just be walking like on my commute and just saying it out loud to myself, you know, like a crazy person on the street. So I feel like by the time the interviews rolled around, I felt like all of my stories that I could share were pretty well prepared, and I didn't have any notes or anything. And I feel like at that point, it was just so fun to listen to other people's stories too. And I could tell everyone that was there, including myself, was very nervous, but that almost made it like a kind of like a camaraderie. Like everyone on the interviews were like very supportive of each other's answers. Everyone was, you know, saying, oh, it's like so great to hear your story. So I thought that was really fun, actually. One thing I noticed, and I remember on my particular panel, I think there was 4 people or 5 people, and 2 of us got past the panel interviews, and the other girl besides me that did, and she's great and I know her now, but I remembered her because she was so like genuine in her answers. And it's not like she had like a crazy, amazing, like super stacked full resume, which she did, but like that wasn't even the relevant part. The relevant part was she was just so genuine and just talked about it, like talked through her answers just like it was a conversation. Like she was so engaging. She wasn't just listing off stuff she did. So I was like, oh my gosh, this girl is totally going to get it. And she definitely did. So just, I think it's important to be very prepared, but also just when you're there, just relax. And Gavin mentioned that you do get a little bit of time to think about, there's whatever, let's say you have 5 questions, you definitely have, you're going to go first for 1 question, essentially. All the other questions, you're going to have a pause to think about first. So that really helps.
Thank you. That's really helpful.
Okay, Jocelyn, question from you.
Hi. First of all, I want to thank you all for all the insightful tips. I just had a quick question about like a ACLS certification. So I know you said that it's not required, but do you recommend getting it prior to the residency, or is that something that we'll do while we're in the residency program?
So at Stanford, you have, you need to get your ACLS certification within 6 months of hire. So you do not have to have it to apply. We do not give any points for BLS, ACLS. So should you say this is something that I'm passionate about, I want to do, absolutely. If you're like, no, I'm tapped out, then you can absolutely wait.
Gotcha. Thank you so much.
Sure. Anna, question from you.
Hi, nice to meet you all. I'm just curious actually how you guys chose your specialty areas. That's really it, because as someone who's still trying to figure it out, I'd like tips on how you decided.
All right, Gavin, you chose critical care. Tell us why. He's like, I don't know. I don't know why I chose that. No, I'm kidding.
Actually, I had a lot of experience in the pre-hospital realm. In my previous lifetime, I was in EMT on the ambulance working 911, and we had some pretty exciting cardiac calls. And so I've always had an interest. I buried myself in EKGs. I learned, I picked up ACLS. I was that crazy guy. And so my biggest advice for you, kind of when selecting your unit, kind of reflect on all of your clinicals, all of your experience, everything you've studied. See what really made you interested, what made you kind of think about it at night and kind of deep dive into any topic, whatever unit, whatever topic, whatever niche, there's a place for you at Stanford. And so really just kind of take a moment and reflect on yourself, and only you'll be able to answer that question. And so I like sick hearts. I like really being able to help people in their most critical moments. And I get that on my unit. And so kind of whatever, even abstract thoughts can lead into topics that you might not imagine, and it'll bring you to where you want to go.
Daniel.
Yeah, my story is not as complex as Gavin's. The reason I picked oncology was actually I worked as a nursing assistant in the unit that I'm currently a nurse in. And the only reason I picked that nursing assistant job was because it matched up well with my schedule. I had no idea what oncology, or I knew what oncology was, but I didn't know that that's what I wanted to do. But once I got on the floor as a nursing assistant and now as a nurse, I realized that oncology is a perfect fit for me because you're dealing with a lot of sick patients, and obviously there's that clinical aspect where you have to manage the patient clinically, but also there's a lot of emotional and compassionate care involved as well. You get the patients that are newly cancer diagnosis in their early 20s, and you kind of have to deal with that emotional side of that new diagnosis, or you'll get patients in end stage cancer that are on the verge of death, and you have to deal with that those kind of conversations as well. So I think the combination of dealing with the emotional side and providing that compassionate care, that holistic care, in addition to the clinically sick patients and managing them, I think that really drew me into oncology. I can critically think, but at the same time, I'm also encouraged to kind of emotionally support the patients as well.
Alina.
So for me, in terms of choosing like on the application, for us, we only had 4 choices. We could put medicine, surgery, oncology, or ICU. So it was much more limited than you guys are going to get. But I was trying to be strategic at first. I was like, okay, what is my experience align with best out of these 4 areas? So I put medicine first because I felt like my experience aligned best for medicine. And then I got chosen for, you don't really get to choose outside of those areas. The managers choose you. So I got chosen for the observation unit, which not all hospitals have this. It's basically most of our patients are from the emergency department, and they need like 40 hours more of observation. So it's kind of like a short stay unit. It's very short, very fast turnover. And for me, that actually ended up being really great. I felt like it was a really good fit because you change your patients every 2 days. You get exposed to basically all of your standard medical problems that people come into the ED for. Yeah, so I was just trying to be strategic. I don't know if that actually, was relevant in any way or if that's how you get chosen or not, but I thought my experience aligned best with the general umbrella of medicine. So that's how I put it down.
That was helpful. Thank you. It's like 3 different ways to decide.
And Anna, I appreciate you asking that question. It's something that I would encourage all of you to take some time and reflect on. A lot of times we may not kind of look at what our skill set is and see what aligns or what of our experiences are. And sometimes we make a decision on excitement or passion, and that doesn't always align. So if you're like, I really want to do ICU, or I really want to do ED, or I really want to do oncology, but I haven't had any experiences in any of those areas, my recommendation would be to try to shadow or to get an experience. It is really enlightening when you see something firsthand, what that will be like. For example, some of our ICU residents who have struggled didn't realize kind of how isolating it can be because you're in a room. There's not a lot of interaction with patients at Stanford. So the teaching aspect is removed. So things like that, they didn't really understand. And so I think it doesn't mean if I choose medicine or if I choose oncology or if I choose critical care, that's where I will spend my entire career. There is opportunities within our organization and many organizations to grow, to change specialty areas, to go through specialty training programs. So know that it's not kind of a check the box and that's what I am for life. But it's one thing to say, what is my skill set now and where will I be successful in this transition based on what I have done and what I know about myself. So just kind of have that honest conversation with yourself, before you kind of dive into something brand new and commit to that thing for your job full time for what we hope will be a longer period of time, but it's a big commitment. So you want to make sure it's the right commitment. Nora, question from you.
Hi, everyone. My name is Nora, and I'm currently in my last quarter of nursing school here in Chicago, Illinois. My question is for the panelists. What aspect of the program did you find the most difficult, and how did you cope with that?
Okay. Who's up? Daniel, you want to go? Biggest challenge?
Yeah, I think for me, it was just the aspect of you get 1 week of hospital orientation, and then the next week you're kind of hitting the ground running and you're on the floor already. And so I feel like in the beginning, it was a little too fast for me, and it was hard for me to keep up at times with my preceptor or, just with some of the things that were going on in the unit. But I think over time, I was open in communicating with my preceptor, and I told her this is the areas that I'm struggling in, and this is the areas that I feel like I'm excelling in. And, she was very helpful to bridge that gap between the lack of knowledge that I had and where I wanted to be. And, it was hard initially because it feels like you're full sprint on the treadmill. But, over time, with the help of your preceptor and, Kerry and the NPDS, the person that's kind of following your journey through the nurse residency program, I was able to bridge that gap between my lack of knowledge and where I wanted to be. So initially it was hard, but eventually I ended up catching up. So
yeah, I will say it's definitely a learning curve, especially if you haven't had too intensive like a integration capstone or other kinds of clinical experience. For me, I was like the COVID class, so our capstones and everything was canceled, and I felt going in that I really don't have a lot of the clinical skills that maybe other people would in my situation. So I was a little bit nervous about that. And then you walk into a patient's room like week 2 and you're like, hello, I'll be your nurse today. And they're in your head, you're like, oh my God, like what? I'm a nurse. And then I have the responsibilities of a nurse. But I think the orientation process follows you pretty closely, and there's a lot of opportunities to check in, both with yourself and with your preceptors and with your, like unit management, and everyone's been really supportive. So as long as you voice your concerns and ask questions, I don't think it should be a problem. I was hired for a night shift, and I think that was another challenge that was pretty difficult to adjust to, but that's a different topic. Yeah, I think the learning curve is steep, but it's manageable.
Thank you so much.
You want to add something, Kevin?
I'll just add one quick note to what everyone else has been saying, but one of my mentors on my unit has told me to be comfortable being uncomfortable. You will be simulated drowning, but your preceptors will do that on purpose to let you kind of grow and to kind of understand what your unit will be like when you're by yourself. That's not to say you won't have any support. You will have a bunch of support every day, every hour. Your preceptors checking in on you, gauging you, and really seeing if you need help, they will jump in. If you don't know, they'll jump in. They'll be a safety net for you, and they'll be there. And you'll have other experienced nursing staff there to kind of watch your growth and to kind of support you, to be your safety net, to check in with you. Even if they're not already pre-scheduled, they'll work with you. So you will always be supported, even though you feel like the world is crashing down and everything is burning.
Okay, Oliver, question from you.
Yeah, I was curious sort of about maybe the projects during the nurse residency cohort and any like teamwork or anything like that related to that was done during the nurse residency program. Just how that experience was from the panelists.
We do have one bigger project towards the end of the program. It's the evidence-based practice. I just presented mine on our graduation a couple weeks ago. You work with a group of nurse residents, both on your unit and sometimes other units too. And you basically choose a research topic, and it's a PowerPoint presentation at the end. It's pretty straightforward, but I think depending on the floor that you're on, there are opportunities to get involved in different research areas or like stuff that's happening on the unit specific things, but that varies across the units.
Just looking at time, I think we have time for maybe 2 more questions for those of you who still have your hands raised. If you want to put your question in the chat, and I'll ask my team to answer, Letty or Kristi or Kat. But Ari, you want to shoot your question?
Sure thing, thanks. Thank you for organizing. Oliver, I had the same question, but I'll kind of do it a little differently. Just curious what kind of team building initiatives and other opportunities exist within the units, I guess for the residents, regarding kind of building that social fabric and really feeling like that sense of community and teamwork on the individual units.
I feel like that's so unit specific, but I know a lot of the units, my own included, it's a little bit harder with COVID, but now things are kind of opening up. We've had like happy hours for the whole unit. People often bring like food, so a lot of potlucks. Even with COVID, I think people are making it work in terms of connecting with each other. Sometimes it's more official things where we had like a Christmas party where they rented out like a bar basically and everyone came. And sometimes it's unofficial things, but it's super unit specific.
Okay, and our last question, I hope I pronounced your name correctly. Nathane, did I even close?
Close, Nathane.
Okay, your question.
Yeah, thank you for putting this together. My question is for the panel, like as a candidate, how do you think we can kind of prepare ourselves coming into the program, since we all had varied experiences and kind of having clinical experiences where we didn't get as much hands-on? Do you guys have any suggestions as what we can do to prepare ourselves to be successful?
Okay, Alina, go.
I feel like I'm to prepare yourself. Honestly, I would say just come in with a super active learning attitude. Besides just doing your ACLS, I don't necessarily think you need to do any kind of super crazy extra preparation. If you do get hired for a pretty specific unit, like let's say it's a cardiac floor, I would just go over like some cardiac notes before you start, but I wouldn't stress too much about that. I think the training program is really great and you'll get what you need to get as long as you come in with like a really good learning attitude and ask a lot of questions.
Thank you.
Daniel, anything, or Gavin, anything to add to that question?
Yeah, I think just real quick, just be prepared to sometimes be pushed out of your comfort zone with the realization or understanding that your preceptor is there to support you if you do kind of fall. They're your safety net. And, you know, thinking about all the people on my unit who are going to be precepting new grads, I just think how supportive they were to me and how supportive they still are to me, because I'm still a new nurse. I have a lot of questions still. So, you know, obviously there's a little bit of fear involved when you're working with somebody new, especially when they're in charge of, you know, your learning and stuff like that. But I think just understanding that, you know, they love to teach you, they love to help you grow and stuff like that. And they'll foster an environment of learning and they'll have this care and concern for your nursing development. I think that's very important to understand with the fear that comes along with starting a new job. So.
Wonderful, thank you. So I want to thank our new grad panelists for joining us today and sharing their insight. Also want to give a huge round of applause to Leticia, my colleague, for facilitating this webinar. It's a lot of information. She did an awesome job. And thank you to Carly, who's our HR colleague, for joining us. So a couple things to remember, just to sum up. I know there's a lot of questions in the chat. We probably didn't get through all of them. So reach out, check our website. Our application opens April 18th. We are the adult hospital. We do not have a pediatric and labor delivery unit. That is Lucille Packard. So if you're interested in Lucille Packard, they have a great residency program as well. Check their website. You'll get all the information there, but know that they're two separate residency programs. So if you want to apply to both, you certainly can, but the adult hospital does not have peds or labor and delivery. When you apply, I know you guys like submitting a lot of information. Nurses like all the stuff. I'm going to ask for your resume. I don't care how long it is or how you format it, your resume, your cover letter, you can format it any way you want. I don't care how long it is, we're gonna read it, and your transcripts, unofficial or unofficial. You do not have to have your RN license to apply. You do not have completed, you do not have to have been a graduate yet. You could still be in school to apply. Please, 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 please focus on the answers to those questions that are on the application. We told you what they are. Spend some time. Remember, we do not score your experience. That is your truth. That's what you're sharing with us. So tell us the experience and how the patient responded or how the person responded. That is your story. We don't score that. That last component, what did you learn? How has it shaped you? How has it changed you? That is the meat of your answer. So focus on really what you have learned, how you have grown, and how you have integrated what you have learned into your current practice. That is what we're looking for. So if you're trying to figure out where to really spend your time, focus on that. We will be hosting an interview preparation webinar likely in June, which will focus on preparation for our interviews, which will be in July. So I will communicate with all of your schools the way I've been communicating. We will post it on our website. All the ways you found out about this one is the same ways you'll find out about that one. And we just thank you all for being here so much. I wish you well on behalf of this entire panel. We need nurses. We need all of you to join our community. So wherever you start your career, we wish you the best. Good luck, take care, and be well. And thank you for joining us. Thank you, guys.
Thank you.
Thank you so much. This was very helpful.
Thank
you.
you.
Thank you.
Thank you.
Thank you.